Trenbolone is widely regarded as one of the most potent anabolic steroids ever developed, capable of producing dramatic muscle growth, strength gains, and fat loss. While most users stay within the 200 to 500 mg per week range, some bodybuilders push doses to extreme levels, such as 1,250 mg per week, in pursuit of maximum results. However, at this staggering dosage, the risks far outweigh any potential benefits, and the physical and psychological consequences can be severe, even life-threatening. This video examines what happens when someone uses 1,250 mg of Trenbolone weekly, covering both the extreme performance-enhancing effects and the dangerous, often irreversible side effects. Muscle growth and strength at supraphysiological doses at 1,250 mg per week, Trenbolone's anabolic effects are pushed to their absolute limit. Users experience explosive gains in lean muscle mass, far beyond what is achievable with moderate doses. The drug's ability to enhance nitrogen retention and protein synthesis is maximized, leading to rapid increases in muscle density and size. Strength gains are equally extreme, with lifters often adding significant weight to their lifts in a matter of weeks. However, these results come at a steep cost. The body is not designed to handle such extreme hormonal manipulation, and the side effects quickly become unmanageable. Fat loss and metabolic overdrive. Trenbolone is already highly effective for fat loss at standard doses, but at 1,250 mg per week, its metabolic effects become extreme. The drug drastically increases basal metabolic rate, forcing the body to burn fat at an accelerated pace. Users often report near-complete elimination of subcutaneous fat, leading to a shredded, grainy appearance favored in competitive bodybuilding. However, this level of fat loss is unsustainable and often accompanied by severe muscle catabolism if calories are not kept extremely high. Additionally, the metabolic strain can lead to dangerous fluctuations in blood sugar, increasing the risk of hypoglycemia and insulin resistance. Androgenic side effects at toxic levels. Trenbolone is one of the most androgenic steroids available, and at 1,250 mg per week, its androgenic effects become unbearable for most users. Severe acne, particularly on the back and shoulders, is almost guaranteed. Those genetically predisposed to male pattern baldness will experience rapid hair loss, often to the point of noticeable thinning within weeks. Body hair growth increases dramatically, and some users report a coarsening of facial features due to androgen-induced changes in bone structure. Prostate enlargement is another major concern, leading to urinary obstruction, pain during urination, and increased risk of prostate cancer over time. Cardiovascular collapse, hypertension, heart strain, and blood clots. One of the most immediate and dangerous effects of 1,250 mg Trenbolone per week is its catastrophic impact on cardiovascular health. Blood pressure skyrockets due to extreme vasoconstriction and increased red blood cell production, leading to hypertension that can cause strokes, aneurysms, or heart attacks. The heart muscle itself becomes strained, and long-term use at this dose can lead to left ventricular hypertrophy, thickening of the heart wall, a condition seen in many steroid-abusing bodybuilders who die prematurely. Cholesterol profiles are destroyed, with HDL, good cholesterol, plummeting to near-zero levels and LDL, bad cholesterol, rising to dangerous heights. This combination dramatically accelerates atherosclerosis, drastically increasing the risk of a fatal cardiovascular event. Neurotoxicity and severe psychological breakdown. Trenbolone is notorious for its mental side effects, and at 1,250 mg per week, these effects become debilitating. Tren rage escalates into uncontrollable aggression, paranoia, and even psychotic episodes in some cases. Users report extreme mood swings, crippling anxiety, and depression so severe that it leads to suicidal ideation. Insomnia becomes chronic, with many users unable to sleep more than a few hours per night despite exhaustion. Hallucinations and night terrors are common, further deteriorating mental stability. The neurotoxic effects of Trenbolone at this dose are not fully understood, but evidence suggests potential long-term damage to neurotransmitter systems, possibly contributing to permanent psychological disorders. Complete shutdown of natural testosterone production at 1,250 mg per week. Trenbolone completely obliterates the body's ability to produce testosterone. Without exogenous testosterone supplementation, users will experience full-blown hypogonadism, zero libido, erectile dysfunction, extreme fatigue, and depression. Even with testosterone replacement, recovery after stopping Trenbolone may take years, if it happens at all. Many users never fully regain their natural hormone function, leaving them dependent on testosterone replacement therapy, TRT, for life. Post-cycle recovery is nearly impossible without medical intervention, and the risk of permanent infertility is significantly increased. Liver and kidney failure risks. While Trenbolone is not a 17-alpha alkylated steroid, meaning it's not as liver toxic as oral steroids, 1,250 mg per week still places an enormous strain on the liver. Liver enzymes, AST and ALT, can rise to dangerous levels, indicating severe stress and potential long-term damage. The kidneys are equally at risk due to extreme blood pressure, increased protein metabolism, and potential dehydration from excessive sweating. Cases of acute kidney injury and even kidney failure have been reported in bodybuilders using extreme doses of Trenbolone. Respiratory distress and Tren cough on steroids. Tren cough, the infamous side effect where users experience violent coughing fits after injection, becomes far more frequent and severe at 1,250 mg per week. The cough is caused by Trenbolone entering the lungs and triggering a pulmonary irritation response. At this dose, the coughing fits can be so intense that they lead to vomiting, dizziness, and even loss of consciousness in extreme cases. Some users report feeling like they are suffocating during these episodes, making administration of the drug a terrifying experience. Hyperthermia and uncontrollable sweating. Trenbolone drastically increases body temperature, and at 1,250 mg per week, users often feel like they are burning up from the inside. Night sweats become so severe that individuals wake up in pools of sweat, requiring multiple changes of bedding. During the day, excessive sweating makes normal activities unbearable, and the risk of dehydration and electrolyte imbalances becomes a serious concern. This extreme thermogenic effect can also contribute to dangerous overheating during workouts, increasing the risk of heat stroke. Insulin resistance and diabetic complications. Trenbolone significantly impairs insulin sensitivity, and at 1,250 mg per week, this effect becomes extreme. Users often develop severe insulin resistance, leading to blood sugar spikes and crashes that mimic type 2 diabetes. Without careful monitoring, this can result in hyperglycemia, metabolic syndrome, and even diabetic ketoacidosis in extreme cases. The long-term consequences may include permanent pancreatic damage and a lifelong struggle with blood sugar regulation. Final verdict: a dose that crosses into life-threatening territory using 1,250 mg of Trenbolone per week is not just reckless, it is outright dangerous. The extreme muscle and strength gains come at the cost of nearly every major bodily system. The heart, liver, kidneys, brain, and endocrine system are all pushed to the brink of failure. The psychological toll alone can destroy relationships, careers, and mental health. While some professional bodybuilders may flirt with these doses in pursuit of competitive success, the long-term consequences are often tragic. Early death from heart failure, liver disease, or suicide is not uncommon in this demographic. For anyone considering Trenbolone, even at moderate doses, the risks should be carefully weighed. At 1,250 mg per week, the price of temporary muscle growth is far too high. There is no safe way to use Trenbolone at this dosage, and those who attempt it are gambling with their health and their life. Responsible steroid use involves understanding limits, prioritizing health, and recognizing that no amount of muscle is worth irreversible bodily damage or death.